Good morning. Well, it's morning anyway. It's morning. Well, with two orthoptists off this week, wow. Chapter 18 Congenital and Systemic Disease Associated with Ocular, Motor, and Visual Disorders. We covered quite a bit. We have quite a bit more to cover. Thankfully, the individuals that drafted the AOC syllabus found plenty of important information to disseminate. We talked over the last couple of days about section 10, which is intracranial neoplasm. Now, the common types are supracellular, SUPRASELLAR, the supracellular tumors, which are in the region of the optic nerve, the optic chiasm, the pituitary gland, the hypothalamus, and the third ventricles. Uh, you know, without you know, without having a diagram or a picture to look at, the lateral ventricles are, and since you're not watching this, you are not seeing that I'm pointing relatively to the top of my head. And the lateral ventricles, LATERAL, lateral ventricles are 1 and 2 or 1 and 2, but they're 1 and 2. Located toward the top of the brain, anatomically speaking, and inside of which are the choroid plexus, plexus, choroid plexus, which is where the cerebrospinal fluid is produced and secreted. The cerebrospinal fluid is a fluid which has multi purposes, but one of which is a cushioning effect that holds and protects the CNS, the brainstem, optic nerves, and the spinal cord. And these uh, supracellular tumors are tumors that are in the region close to the optic nerve, the optic chiasm, which is where the nasal fibers decussate to the other side, making possible, most importantly, binocularity. And of secondary importance, but nevertheless important, is this direct and consensual pupillary response, which makes it possible for us to ascertain whether a relative afferent pupillary defect is present, even if a patient has a fixed blown pupil on one side for some reason. It may be traumatic in nature, a trauma to the anterior aspect of the eye causing some uh, damage to the iris, but not, damage to the retina or optic nerve, which would then produce a relative afferent pupillary defect, a defect in the afferent portion of the pupil pathway. And it is this decussation not only of the visual fibers from the nasal side of the retina of both eyes over to eventually end up in the occipital region of the contralateral eye, so that the nasal of the right eye ends up with the temporal of the left eye and gives rise to binocular function, which many of our patients have, some don't. But this region, which is the placement of suprasellar tumors adjacent to the area, including the optic nerve, chiasm, pituitary, which is right at the midline, the hypothalamus, and the third ventricle. So, what led me to say all of that was moments ago I was talking about the positioning of the lateral ventricles, 1 and 2, or 2 and 1, which, however you want to name them. But below and behind the lateral ventricles is the third ventricle. And these tumors produce all kinds of problems with visual acuity, uh, visual field defects, uh, nystagmus, strabismus, all of these different uh, uh, ocular, motor, and visual disorders can result from these intracranial neoplasms. But of only one type is the suprasellar tumors. Another type is called a hemispheric astrocytoma. It's a cancer of the brain or spinal cord, and some of these astrocytomas, which astrocytoma is a type of cancer, um, can certainly produce uh, some serious problems, not only from an ocular standpoint, but also from a greater systemic uh, perspective. We go all the way back to maybe the first 1 or 2 lines of this section on intracranial neoplasms in infants and young children. Some of the systemic signs and symptoms include personality changes, uh, and failure to thrive, and seizures. So serious, serious issues. So we have these suprasellar tumors, we have these hemispheric astrocytomas, and we have these posterior fossa tumors, which are found in a small space inside the skull near the brainstem and the cerebellum. And the cerebellum, if you were looking at a cross section of the brain, uh, not a coronal view, but a sagittal view, which is, well, I'll show you. This is a sagittal view of a cross section of the brain, and this big green spot back here, the big pink thing surrounding the green thing, which is supposed to be a cerebellar tumor. This pink organ here is the cerebellum. So brainstem right here in the middle, cerebrum up here, brainstem, cerebellum back here. So that's where we're talking. Anyway, in this area back here, we have the lateral ventricles up here. We have the third ventricle back here. It's a hole, through which this um, cerebral spinal fluid passes. And importantly, so I'll mention it again, the cerebellum is a part of the brain that's responsible for balance and coordinated movement. And so these patients may certainly have um difficulty uh, maintaining control over vital body functions. Not that you're watching this, but yes, you will have noticed that we've transitioned away from our holiday mugs. And one of the problems with beautiful things is that they become less uh, functional from what we consider a normal function of something to be. If you can't, and some people, my son included, won't use his microwave because it's dangerous. But if you have something that's not microwave safe, oftentimes in the 21st century, you won't use it because it's lost some of its function. So, how did I get to that? Well, I got to that because these posterior fossa tumors can certainly, because of where they are um, near the cerebellum, can cause and disrupt function of the cerebellum, which is certainly in conjunction with the brainstem, is very important in controlling vital bodily functions. On we go. Section B, in older children and adults. So intracranial neoplasms can also be acquired, so to speak. I mean, in the infant and in the young child, that tumor, that neoplasm may have been there from the very beginning of time, and because of its slow growth, did not, from a sign and symptom standpoint, rear its ugly head until several months into uh, childhood. Some types of neoplasms may certainly be acquired, and those would be more generally seen in older children and adults. Signs and symptoms would include acquired acquired forms of what we saw in the infants, but acquired balance, movement, and coordination problems, hemiparesis, paresis on one side of the body, uh, clumsiness, clumsy behavior, and ataxia. And it's not uncommon, especially in a pediatric clinic, it's not uncommon for a parent to say that their toddler is clumsy. Their toddler seems to trip and fall, seems to um, run into things with some frequency. As a child gets older and becomes more coordinated, becomes more uh, fluid and efficient in their movement, then what seems to be an acquired clumsiness or ataxia should sound alarm bells. So, acquired balance, movement, and coordination abnormalities, nausea and vomiting, just for seemingly no uh, experience or visual reason. Experience meaning the whole family is eating something that is making them uh, sick, nauseous, uh, and vomiting. That's not what we're talking about, but an isolated situation where someone experiencing the same um, environment and food sources who is nauseated and vomiting in uh, exclusion of anyone else in the family with said symptoms, that would be uh, a sign of an acquired neoplasm. And as well, headaches. It's concerning among the pediatric population for a child to complain of headaches because it's just not a normal kind of thing. So, systemic signs and symptoms of older children and adults with neoplasms, acquired balance, movement, coordination problems, hemiparesis. That would be a warning bell right there. Of course, clumsiness, ataxia, nausea, vomiting, and acquired um, recurrent, persistent headaches. Ocular signs of acquired intracranial neoplasms would be strabismus in various forms, cranial nerve palsies, skew deviations, uh, supranuclear strabismus, um, gaze palsies. All of these forms uh, can present themselves and can be the presenting sign of an acquired intracranial neoplasm in this older children to adult stage. Nystagmus, various forms of nystagmus can be seen in an acquired form, vestibular nystagmus, or uh, uh, especially a nystagmus associated with uh, movement, rotation, acceleration, deceleration, um, rotation of the head and body, convergence retraction nystagmus, which is a characteristic of Perono's syndrome, which is a characteristic of which is characteristic of Perono's syndrome, which is generally said to be secondary to a pineal gland tumor. So there you go, acquired intracranial um, neoplasm, gaze evoked, um, and seesaw nystagmus. So various forms of nystagmus. So acquired nystagmus would always be uh, a sign that would ring an alarm bell in this age group. In addition to among ocular signs, in addition to strabismus and nystagmus, would be decreased visual acuity, uh, visual field defects, and or optic atrophy. Now, common types of um, acquired intracranial neoplasms in this older children to adult range would be metastatic or metastasis. This is a process by which a tumor in one area of the body seeds or travels to um, another part of the body. Metastasis is a word that we understand and metastasis always strikes fear into a patient, into the parents of a patient, into the family of a patient with a cancerous tumor. Another common form of intracranial neoplasm in this older child and adult category is pituitary adenoma. This is a tumor of the pituitary gland. Most pituitary adenomas are slow growing and benign. However, as we've found and discussed in previous contexts, um, benign from the standpoint of is it cancerous? No, but not benign from the standpoint of a tumor that is growing and seeding cancer cells to other parts of the body. But while most pituitary adenomas are slow growing and benign, which means that they are not cancer and do not spread to other parts of the body, they can grow to be quite large and can put pressure on nearby structures, and because of where the pituitary gland is, let me see if this diagram back here. Well, yeah, I mean the pituitary gland is here in the middle. So, I mean it's not diagrammed on. I mean there's not a arrow pointing to it, but it's and it's right there in the center. But not a it's not the best camera in the world. But um, although they're not cancerous and don't spread or don't metastasize to other parts of the body, they can grow big, these pituitary adenomas, and put pressure on nearby structures, which can include cranial nerves, can include the optic nerve, can include the optic chiasm. So it can produce all of those ocular signs that we said before. It can produce strabismus secondary to a variety uh, of incomitant kinds of deviation, gaze palsies, skew deviations, etc., but also can produce reduced vision, visual field defects, and optic atrophy, which all lead to a reduction in visual function, not motor function, although it can, but also visual function. So these intracranial neoplasms can cause ocular, motor, and visual disorders to occur and are therefore well appointed to be in chapter 18. Next is something that we know something about, which we are not going to cover today, and we are not going to cover tomorrow. Tomorrow I am in Brighton, so I will be undoubtedly leaving by the time we speak this morning, and heading up to see patients up there because, as I said, the absence of two orthoptists at the same time. Have a good day today. Hope you're enjoying your vacation. Peace.